Talking about the acute stress reactions that a person can have in any stressful reactions in his life can be very important. Now, there are a lot of variants to these stressful reactions. The person can have the acute attacks that are self-limiting, and that won't need any medical intervention. And then they can vary from the post-traumatic stress disorders towards the somatoform disorders, and then the other variants are the dissociative disorders. Now, as the name indicates, the dissociative disorders are usually defined as the person basically loses connection between the thoughts, the memories, the actions, and the surroundings. Now, it's quite an unrealistic and unhealthy way of disconnection between the surroundings and the person, and it affects his daily life routines. So the functionality of the person is basically affected in such situations. So we have to take this person out of these dissociative disorders, these conversion disorders. So the other name to these dissociative disorders are also known as the conversion disorders. Sometimes just by counseling, you take that person out of that conditions, and sometimes they need the medical treatments, they need the pharmacotherapies combined with the counseling sessions. So that is what we're going to discuss over here. Along with these dissociative disorders, we're going to discuss the adjustment disorders as well. We're going to discuss the manifestations of these adjustment disorders along with these dissociative disorders, and then we're going to look upon the management guidelines of these disorders as well. Talking about the risk factors, obviously, a lot of risk factors, they are present within the person and then in the surroundings of that person. So the environmental factors also play a pivotal role in the diagnosis and as well as the management of such disorders. The prognosis of such conditions, we'll be discussing that, and along with that we'll be discussing the risk factors that are involved in such conditions. Now, the adjustment disorders that are usually, they revolve around the factor that the states of the subjective distress and the emotional disturbances are usually seen in such individuals. They are usually interfering with the social functioning in the periods of adaptations to significant life change in these stressful events. So usually it's the childhood phase that is affected for these adjustment disorders, and it can be any stressful reactions in the life of the child. It can be the parental separation. So the effective parenting is also going to be dug out if the role of the father and the role of the mother is quite well defined in the life of the child or not. So this is what the child needs, the social interactions, the parenthood that he needs. So this is going to highlight whether the person, if there is a severe change in the lifestyle of that child, he's going to suffer from those emotional disturbances and the subjective distresses as well. The occurrence risks are it can be an individual predisposition or the shaping of the manifestations as well. The predominant features is usually quite brief or prolonged depressive reaction. It can basically encompass the whole phase of the childhood or the whole phase of the adolescent child groups. The manifestations, they usually include the low mood, the anxiety or worry or a mixture of these, and then the feeling of inability to cope or plan ahead. So this is the anhedonia or the inertia that he's going to have. He's going to feel the loss of energy, the loss of pleasurable activities in his life, and the planning will also be affected in such individuals. Some degree of disability is also observed in these individuals as well. Talking about the management of such adjustment disorders, that will basically include, there's no need to intervene such cases sometimes, and if PTSD symptoms persist, the PTSD treatments, that will obviously include the social support treatment. Along with that, there can be the counseling sessions if the social support is not available to that person, and then the pharmacotherapies that include the SSRIs and the antidepressants can be given to such individuals as well. The anxiety and the depressive symptoms can be collectively, or there's going to be a mixed picture in these individuals. The panics, attacks, as well as the depressive symptoms are going to be seen. So the treatment is also going to be missed depending upon the dominance of the symptoms. Talking about the dissociative disorders, now this is another condition that the person can suffer from in these stressful conditions. When we define such conditions, it's basically the person disconnects from his surroundings. There is a disconnection in his thoughts, in his memories, in his actions, and from the surroundings as well. Now, this disconnection is going to affect the functionality of the person as well. It is going to be unhealthy for the person and unrealistic as well. The symptoms, usually there's an array of physical symptoms seen in such individuals. The psychological, it's usually psychological in origin. The symptoms often appear suddenly. They remit often after a few weeks or months. And the onset is associated with the traumatic event. The interpersonal difficulties, the person won't be even be able to understand his feelings as well. At times he would feel depressed, at times he'd feel manic. So there will be basically a bipolar affective disorder seen in these individuals as well. The main dissociative disorders and the presentations that usually include the dissociative amnesia. So he'll basically get rid of those traumatic thoughts as well in his mind of that particular event. So loss of memory is going to be observed in such individuals. Then it can be not due to any organic condition. This loss of memory particularly is not due to any organic condition that he's suffering from. It's usually a defense mechanism that is applied by the body, that is applied by the brain. It's usually partial or selective in these individuals. It is centered on the traumatic events. The dissociative fugue, the features of the dissociative amnesia would be present in these individuals. There'll be a purposeful travel, unaware of their origin. And then the dissociative stupor is another condition. Profound diminution and absence of the voluntary movements. The person would remain static, he won't move himself, and there won't be any organic disorder as well. So this is another defense mechanism, and the normal responses to the external stimuli would be present, and there'll be no evidence of the physical cause for the stupor that the person is suffering from. So these are the different variants: the dissociative amnesia, the dissociative fugue, and the dissociative stupor. These are the different defense mechanism, and basically the person is running away from the thoughts in his mind. It's the defense mechanism, it's the conversion mechanism that he's suffering from over here. The trance and the progression disorder, possession disorder, that is basically including the temporary loss of the sense of personal identity, involving the awareness of the surroundings. The diagnosis and the states are involuntary usually and shouldn't be applied to the trances as well. The dissociative convulsions, they may mimic the epileptic seizures. The tongue biting, bruising are quite rare in such individuals. The consciousness is maintained by the individual and they're replaced by the state of the stupor or the trance. So sometimes even these possession disorders or the dissociative convulsions are seen in these individuals as well. Now, the dissociative motor disorders, they include the loss of ability to move a limb, and then the resemblance to ataxia or apraxia is also present. Akinesia and aphonia, the person won't be able to talk and the person won't be able to move. Dysarthria or dyskinesias, if the movements and if the speech is present, it's not going to be quite functional in their cause. The seizures or paralysis may also ensue in such individuals. The other dissociative disorders, they basically include the dissociative anesthesia and sensory loss. That is basically the loss of sensation to the skin area. No anatomical sense is present associated with the ideas about the bodily functions, and there is the loss of vision and hearing also observed in such individuals. Then moving on to the dissociative identity disorder, that will include the multiple split personalities, controversial diagnosis, good evidence for validity would be there, and association with the childhood trauma would also be seen in such individuals. Then the prevalence with people with the PTSD, the prevalence is seen in such individuals. It is not clear. Substance misuse sometimes highlight these symptoms, and in those with eating disorders, the risk factors are not usually clear. They're usually due to the psychological mechanisms, and no genetic contribution is usually seen. The psychological trauma precipitates these conditions sometimes, and that is considered to be a risk factor in these dissociative conditions. The management guidelines, they usually include the long-term follow-up studies. That includes the bizarre presentations, the actual underlying pathology is not known. They ascertain the actual physiological cause, and the long-term psychotherapies are sometimes also considered in such individuals. So treating post-traumatic stress disorders is sometimes just by the CBTs, that is the cognitive behavioral therapies. That is all sometimes you need. So that is the end of this section. Thank you for watching sqadia.com.